Hi, my name is Chris Min, and I'm a board certified neurologist, but who's been out of direct patient care for the last 10 years. And I volunteered to work at my old institution, Columbia University New York Presbyterian Hospital. I've been taking direct care of COVID patients, and this past week was working on inpatient wards as well as did a few shifts in the emergency room, which is, I think, where I'm going to be for the remainder of my service during this epidemic. I wanted to emphasize a theme of gratitude for this second entry to my vlog. And I really agree with my minister at All Souls Church, who's written extensively about this. Galen Gungerich has written a book about the way of gratitude, and I think that it's a really great centering approach to life, and really helpful to think about in times of challenge like this pandemic. On that note, I'd like to first thank my college classmate and friend who so generously is allowing me to stay at her apartment here on the Upper West Side. Bonnie Huang just reached out to me and said, I see that you're volunteering at a hospital. Do you need a place to stay? I think she understood, having a husband who's a surgeon, that not only was I potentially putting myself at risk, but I could be putting my own family at risk, and wanted to thank her for letting me stay here while I'm volunteering. And I also wanted to thank Roy Lackey. I mentioned him in the vlog last time, and he's a friend from back in college. We were working in the same research lab together, and at various times our careers have intersected, also, including when we were both on clinical staff at Columbia. But it had been at least 10 years since I had had a conversation with him, and just by chance, I got assigned to work with him on the wards, and he just really looked out for me, helped me get oriented on inpatient medicine again, and just was just a great friend. I'd like to move on to some of the people I met and for whom I have such gratitude and for their service. The first one is a woman, an ER nurse, Becca, who came from Utah to help out in the epidemic. Apparently, Intermountain Health, which is the health system that she's part of, sponsored 50 healthcare givers, doctors, nurses, and others to come out here and volunteer. So she's been living the past couple of weeks in Teaneck and some hotel, and just coming into the ER and working around these shifts. And it was kind of amazing to talk to this person. She's from apparently a small town. Honestly, I forgot the name of the town in Utah. And she works at the hospital where they only have 7 ER beds, and she's the only ER nurse for the entire hospital. And now she was in a system where we have this immense ER in the city, and when we were at our apex, we had 165 patients there, and she just plugged herself in and just worked in the system. So, I mean, it's just amazing to see people like her, and she just has such a positive attitude. Another person I'd like to mention is Spider. He's a security guard who works in the emergency room, and our emergency room has a number of security guards deployed throughout, and these folks are so essential to keeping us safe. In general, it's a safe working place, but there's some occasionally unruly characters that show up, and Spider is the kind of guy who keeps us safe. More than that, he also embodies the kind of attitude that everyone in the ER has, which is helping out in every way they can. And he was so helpful to me also in terms of helping me out with Spanish, because a number of our patients speak Spanish, and unfortunately my Spanish is quite limited. Another person I wanted to mention was Daniel. He was an ER nurse working there, and I came to discover that, like me, he had left acute patient care for a number of years ago. He left, and he used to work at Columbia, but he left and started a new life in New Mexico, started a family. But when he read about the COVID epidemic and what it was doing to New York, he just felt that he needed to come and help out. So he made his way to New York. He apparently still has contacts here, and who helped him find a low rent apartment downtown, so he's been staying there. And he's been working in the emergency room. Just a great guy. And I have a picture of him putting an IV into one of our patients. And then I just want to mention Alex. Alex is a third year emergency medicine resident, and fantastic doctor. But I interacted with her because of I actually wasn't involved directly in the patient care of this woman, but there's a little old woman who came in with flash pulmonary edema. Flash pulmonary edema is something that happens to people with congestive heart failure, and sometimes is caused by stresses to the system, such as an infection. So it was presumed that she had a COVID infection, which led to her flash pulmonary edema. And she looked terrible when she came in. She looked like she needed to be intubated immediately. Alex really wanted to avoid doing something so invasive to this woman, and yet she needed a way to keep her ventilated. And so she had to think about things, and she thought about using BiPAP. But in the days of COVID, you can't administer BiPAP because it's potentially aerosolizes the virus. We have a negative pressure room, but it's tucked in a back corner of the emergency room. And Alex wanted her patient in the line of sight of the doc box, which is where she is when she's not directly seeing patients. And so she and the staff managed to come up with a MacGyver-like solution where they put a tent around this, a clear tent around the patient so that they could try to contain the virus as best they could, and administer BiPAP in a situation that was tolerable. Um, and then next, I'd like to just switch into thanking all of our first line workers, not just the healthcare providers, but all the essential workers out there. My last patient I wanted to mention was a 28-year-old policeman, and he is fairly ill with COVID. He came walking in, however, his oxygen saturation was really on the cusp. When he was walking in room air, it dipped down to even below 90%. When we normally breathe, our oxygen levels are generally greater than 98%. And you can see that this is the representation of oxygen binding to hemoglobin. And the partial pressure of oxygen in room air is about 160 millimeters. So you're at 98 to 100% saturation of hemoglobin. But and 90% sounds not so bad compared to 98. But if you look at this curve, 90% is the critical point where the curve steepens, and small changes in oxygen will lead to huge changes in the amount of hemoglobin carrying oxygen. And that's what leads to real trouble and is kind of a determining point of potentially intubating someone. I hope that he is going to actually get better because most people who do run into trouble with this disease 8 to 10 days after symptoms start, and he's at day 9. And I think that hopefully he'll just need some oxygen support and get better. But he was in that danger zone where things could turn south in a hurry. So I will check on him today when I come to the hospital. But all of these frontline workers are really taking on great risks in performing their functions. And I was recently made aware that Alicia Keys made a song expressing gratitude to every frontline worker. And I know a friend of mine sent me the link, and I just thought those of you who haven't heard the song yet might enjoy this, so I tacked it on. Thanks for listening.
You're the engine that makes all things go, and you're always in disguise, my hero. I see your light in the dark, smile in my face when we all know it's hard. There's no way to ever pay you back. Bless your heart, know I love you for that. honest and selfless. I don't know if this helps it, but good job. You're doing a good job, a good job. You're doing a good job, don't get too down. The world needs you now. Know that you matter, 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 yeah. You're doing a good job, a good job. You're doing a good job, don't get too down. The world needs you now. Know that you matter, 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 yeah. 6 in the morning, and soon as you walk through that door, everyone needs you again. The world's out of order. It's not as sound when you're not around. All day on your feet, hard to keep that energy. I know when it feels like the end of the road, you don't let go, you just press forward. You're the engine that makes all things go. Always in disguise, my hero. I see a light in the dark. Smile in my face when we all know it's hard. There's no way to ever pay you back. Bless your heart, know I love you for that. Honest and selfless. I don't know if this helps it, but good job. You're doing a good job, a good job. You're doing a good job, don't get too down. The world needs you now. Know that you matter, matter, matter. Yeah, it's a good job. Doing a good job, a good job. You're doing a good job, don't get too down. The world needs you now. Know that you matter, matter, matter. The mothers, the fathers, the teachers that reach us, strangers and friends that show up in the end. From the bottom to the top, the listeners that hear us, this is for you. You make me fearless. Oh, don't get too down. The world needs